were going through a lot of stress. I wasn't specifically focused on mental health issues, but we had a program which worked with the whole family. And so we understood the importance of working not just on the medical problem, but on the family issues and keeping the whole family well. Then when I got into politics, I was initially at the federal level and then at the provincial level. But one of the things that was very striking when I became an MLA in River Heights and the provincial Liberal leader is that the tremendous number of people who came walking in my door with problems accessing mental health services and getting this kind of help that they needed. I give you one example. I had a mother who came to me and her son had a major mental health issue. And she realized and recognized when he would start to get into trouble. And there were times when he was well, but every once in a while he would be starting to get into trouble. She could see this, and she made sure that she went down with him. She couldn't find anywhere else, to the emergency department, and to try and get the help that she knew her son needed. They went to emergency department after emergency department. They were turned away. They were told that, you know, your son isn't bad enough to warrant attention. The only way that they could get him in to see the help that he needed was for him to commit a crime so that he could then be picked up by the police, and once he was in the remand center, finally they would recognize that he had a mental health problem and he would start to be looked after. And I looked at this and I said, how terrible it is that we have a system that somebody has to go and commit a crime in order to get the help that they need as a mental health issue. And so, I mean, it became clear to me that we needed to change a lot of the things that we're doing in this province, and I started becoming increasingly involved. I also noticed that for this young man, because he was in his early 20s, that he would be fine during the summer. But each winter, as it got into November and December and the days got darker and you had less sunlight, he would get into trouble. And having a medical background and knowing about what they call the seasonal affective disorder, where people get depressed because they don't have enough sunlight, and his situation wasn't a strict depression. It wasn't a traditional sad disorder in a sense, but it was another mental health condition. But here it was displaying this kind of periodicity in which it got worse in the winter and was fine in the summer. And it seemed to me that, you know, we needed to be paying a lot more attention in terms of prevention to some fundamental things which we know can benefit mental health. You know, more sunlight. Most of us feel a little bit better when it's sunny outside and we can go outside, right? Exercise. You know, increasing studies have shown that exercise improves and helps your brain and helps your mental health situation, and diet. And although, I mean, we know that people should have a good balanced diet, interestingly enough, I have been doing some research on fatty acids. One of the things I have been working with is some brain fatty acids, which are derived from fish oils. And one of the things is that the brain has some of the highest concentration of these fatty acids, which are derived primarily in our diet from fish oils. and looking at the information worldwide and seeing a rather striking relationship between the incidence of depression in countries where people had more fish, it was lower, than in countries and areas where people had less fish and there was more depression. And it seemed to me that we should be paying a lot more attention to sunlight and exercise and diet, and that's something that we should be doing in a broader sense. And that, you know, if it didn't help everybody, and it's not an answer, it's not an exchange for drugs or for other things, which are also important, but it's one of those things that when we're trying to boost and improve people's mental health, that we should be paying attention to. And then, as I've been the MLA now for 13 years, things moved along. I kept on working in this area, but one day, a fellow who was a friend, I didn't even know he had a mental health issue, right? He committed suicide. And I talked with people and found out what had happened. You know, to one or two people who he knew very well, they knew what the problem was, but they kept it very close. And of course, there had been physicians looking after him, and he was known to be at risk of suicide, to have periods of deep depression in which things weren't going right and he needed help. And on this occasion, he had gone into the emergency room at one of our hospitals, and he had gone there for help. Suicide or attempted suicide is often a call, a last desperate call for help. And he'd gone there for help, talking about how bad things were and what the situation was and how terrible it was and how bad he was feeling and that he was suicidal and so on. And he was told that, oh, it wasn't severe enough, you're okay, we're going to send you home with a bus ticket and you'll be all right. Well, the next day he was dead. And I said, look, this is terrible. We can't be doing this sort of thing here in Manitoba. And that was the trigger to bring in a mental health Bill of Rights, which we presented at the legislature, and created some specific provisions to try and help and make sure that people who had were suicidal would be able to get the help. But we also talked about a number of other things that needed to be in place in terms of giving people mental health rights. Sadly, we do much better in helping people with physical illnesses than with mental illnesses. We do much better in making sure that people who have physical disabilities are treated well, but we do very poorly, often, not always, at making sure that somebody who has a mental illness, a mental disability, gets treated with the same sort of equality that she should be treated as somebody who's got a physical illness, for example. The kind of supports that are provided are very often very deficient in mental illnesses compared with physical illness. So we put in these measures, and we also put in there some talk about how important it was to be able to have people having a circle of friends or support people. And shortly after that, I had, on more than one occasion, people working in my office who had mental health issues. And they came to me and were honest about, what the situation was, and, they needed time off from time to time, and recognized that they had more difficulty dealing with stress because of their circumstance. So I said, look, we'll make this, a flexible workplace. We'll understand when you need to be able to deal with stress issues, when you need to have time, but you need to let us know, because if you keep it, completely to yourself, that's not going to help anybody, and it's just going to create a problem. So we created, in essence, in the workplace, a network of support to individuals, so that we had a flexible system and could make sure that they could get the support that they needed. Now, in the last, really the last few years, one of the exciting developments has been this large study that's been going on called Housing First, or At Home Chez Soi. And it's looked in a comparative, careful way at the option of providing people with serious mental illnesses housing first, or treating them traditionally. And the findings from this study are just so clear that it is just dramatically better to have somebody treated with housing first, because once they've got housing, it's much easier to help them, to find out where they are, to be able to support them. It's much easier for them to get back on their feet, to create the kind of environment where they're going to be able to not only do well in their life, but do well at work and so on. Creating the kind of flexible environments that will work. But this Housing First has been so clearly demonstrated in a research study that it now needs to be implemented fully for every person who has a serious mental health issues homeless in Manitoba. This is what we did when we were dealing with kids with cancer. We had a trial, we looked at what worked. When we found something that worked, we didn't just treat a few, we treat everybody that way. And that's what we've got to do here. We have to move as fast as possible to make sure that everybody in Manitoba now who's got a serious mental illness, who's homeless, has access to housing first, so that their lives can be improved, they can be helped better, and we can move forward. So there's lots to do. I'm glad you're here. Looking forward to listening to others. And I just think that this whole area is so important that we all need to know much more about it and ready to do much more. Thank you.
Thank you, Jon.